Hello, my name is Kelly Brotman. Just to give a brief introduction of my background in education and experiences so far, I'm from Massachusetts. I actually grew up in a split between Boston and Cape Cod, so I'm very comfortable and familiar with urban settings and also with rural settings. There's no traffic light in the town on Cape Cod that I grew up in. I got my undergraduate degree at Brandeis University, which is right outside of Boston, and that was in biology. So from there, I decided that I wanted to help save the world. I ended up working abroad in Costa Rica, working with leatherback sea turtles and tracking their population. And after that, I loved it so much, I ended up working in Greece, working with loggerhead sea turtles, doing partially the same thing, but also doing a little bit of work with the community. The culture over there is a little different in how they view environmental threats, and a lot of locals in that area did not understand why sea turtle nesting habitat needed to be preserved. So I did a lot of outreach and education over there, mostly in the tourist industry, trying to get tourists to want to see the sea turtles, which means that the locals would want to preserve the tourism. So it's a little roundabout. It gave me a little bit of insight into the politics of how a community actually works. So once I did a couple of stints abroad, I decided it was time for a quote unquote real grown up job, according to my parents. So I ended up teaching high school biology. I got my master's degree in education, and I did that for a number of years. I actually worked in New York City teaching biology. It was actually in Queens, New York, and that was quite an experience. The school had about 4,000 students in it. They couldn't physically all fit in one time, so the school day was very long to make sure all students were accommodated either earlier in the day or later in the day. So that was that was a really interesting experience. I did teaching for about 6 years, and I decided after doing that I love education. Part of it being my overseas turtle work, and the other part being teaching science. But I actually wanted to do science instead of teaching science. So I ended up going back to school again, and I did clinical coursework, which essentially it licenses me to work in any clinical pathology lab in the country. Um, and what that means for people that aren't into pathology and diseases, the clinical pathology laboratories are if you get blood work done or a urinalysis done, or you get something biopsy to see if you have cancer. The particular section that I specialize in is clinical microbiology. So I work with the infectious diseases. I worked for the past 5 years at one of the major Boston hospitals. So we saw a lot of very, very interesting cases, and it really opened my eyes up into the public health sector. Because it was a large hospital, you see a lot of people using the ER as their primary care physician, and you see a lot of people coming in with diabetes complications, a lot of foot amputations, and I was really shocked that an area in the Northeast, especially the Boston area, which is known for its hospitals and clinics and medical professionals, that there could be such a staggering number of people that either don't have access to appropriate healthcare or just are uneducated in terms of their own health, that they don't take care of themselves. Um, we also saw a number of like really rare cases and really cool cases of diseases that don't come along very often, partially because if you're in a small town and a small clinic and you have a rare case, you get bumped up to a hospital. So as a result of seeing all those cases over the last couple of years, I decided to come back for a public health degree, and that's where I find myself now. Um, I'm no longer at the hospital. I actually got a job doing supervisory work at a private microbiology lab, so it's a little more mellow. You don't have the crazy urban environment, but it is much more community based. the labs work very closely with the nurses and doctors that reach out very intimately to patients on a regular basis. So there's a lot of communication that goes back and forth, which is another side of the public health and clinical field that I enjoy seeing that I did not have exposure to when in the hospital. Just to give a couple little side things, because I'm not all business, I like to concoct desserts in my spare time. I started off with the basics, apple pie and chocolate cake, and I go through my phases as I think everyone does. So right now I'm on herbal infusions, floral infusions, and creme brulees is what I'm specializing in at the moment. And just to make sure I do stay healthy, so I practice what I preach. I actually train in Krav Maga. Last year I tested for my black belt. So Krav Maga is, for those of you that haven't heard, it's Israeli street fighting, which sounds a little chaotic, but essentially if you were to ever take one of those weekend self-defense classes, that would be an introduction to Krav Maga. The premise is, rather than doing fancy forms of memorizing particular steps, it's designed to disarm your attacker and deliver as much injury as necessary to get away safely. So the net result is emphasizing your safety and your health. And I like that aspect of it a lot. So I think that summarizes a lot of my life. I live with my husband. Sadly, no pets yet. I'm working on a cat. And my whole family is nearby. We all are from the Massachusetts area, so I'm very much a local. And I have so far enjoyed all the courses that I've taken in this program, and I enjoy hearing about everyone else's experiences because everyone is so much more different than myself. And I'm eager to see what the rest of the program is going to bring. So thanks for listening, and I look forward to getting to know even more of you in the next couple months.